This
There's some
conference will now be recorded.
operational stuff that you probably need to review on your own and kind of go over. The cylinder sizes for the oxygen tanks. I know I've seen on the National Registry, so I'd go over and look at that. Once you pass your test, you're never going to see it again. If you walk up to me and ask me tomorrow what size a Class D cylinder is, I don't know. I'm not going to tell you. Tell me to get the big one or the small one. That's honestly, once you pass the test, there's a bunch of stuff in this class that you'll come to realize that they kind of go over, like the classes of ambulances and stuff like that. Like once you graduate this class, nobody cares. You got a van, you got an ambulance, and you got a real big ambulance. Like that's kind of the way that we look at it. I mean, it's pretty nonsensical, but there is a chance that it does show up on your National Registry test. So I just go over and just kind of peek at some of that stuff, look at some of it, try to remember as much of it as you can, just because there's a chance you see it. I know people that have seen it. So yeah, we're going to dive into this. So this isn't going to be part of your normal stuff. There's not going to be a test over this. There's no homework over this stuff. It's just a big thing that I'm an advocate of. It's a big thing that I push for. It's something that I don't think that's talked about enough in fire and EMS, Sheriff's Department, and I think that it needs to be addressed, and I think it needs to be addressed pretty quick, because when y'all start riding with us, has anybody, who all in here has seen somebody pass away? All right, so a vast majority of people will see somebody pass away in their life, right? Whether it's their parents, whether it's a brother, sister, sibling, family member of some sort. On the flip side, how many people have rolled up on a car wreck in the middle of the interstate and seen somebody's head busted open and them dead in the middle of the interstate, right? So those amount of hands drastically reduced, right? So it's not stuff that you're going to see every day. It's not stuff that, you know, your mind is built to witness on a regular basis. But when you get into this, you do see that stuff. You're going to see it. You're going to walk into people's houses. You're going to see the best of them. You're going to see the worst of them. And unfortunately, a lot of that stuff takes a toll on you in the worst way. And that's on a mental aspect. Physically, we go through it, right? We pick up heavy folks. You hurt your back, you hurt your knees. But mentally, people get driven out of this job because of the stuff they see, the stuff they deal with. And then to make it even worse, if you work for a system or a department that doesn't help you through these processes, it drives you out of this program or drives you out of this job even faster. So we worked for a program for 4 years in Atlanta that you would pick up a dead 4-year-old, do CPR on them all the way to the hospital, and then they'd be like, cool, go run another call, because we had 30 of them holding, and we didn't have time to sit around and say, oh no, the poor pitiful, dead kid, and you didn't have time for that stuff. You didn't have time to, sit there and reflect on it, and it affects you. You don't realize it, but you go home, you start snipping at your wife, start snipping at your husband, start snipping at your kids. You start drinking a little bit more than you're supposed to, and it affects you. You don't realize it, but it does. So I'm a big advocate in the mental health stuff. My name's Chaz. If we haven't talked about this before, the name that you see on this certificate is not what you call me. If you do, I won't answer you. It's my government name, and nobody calls me that except for my wife and my grandmother when I'm in trouble. So click, 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 click.
Your mouse is on the right side.
Click. CJ, my clicker's not clicking.
So swipe either. Try closing the PowerPoint, open up again. Your first click was on the camera.
I'm trying.
All right. So, like I said, if you call me by Christopher, I won't answer you. But I took a critical incident stress management class about a year ago. And the big emphasis on this class was to debrief folks after critical incidents. Like I said, I got into this mainly because of where we worked. I spent 4 years in a system where they didn't care anything about your mental health. They didn't care what call you ran. They didn't care what you just got through. Me and her sat in the middle of a shootout with bullets flying past our ambulance. Got on the radio, told them that we were in the middle of a shootout and bullets were flying past our ambulance, and they asked if we were clear for another call. So I say that because, you know, you work in a system like this where we have amazing bosses. We had an incident where we had an unfortunate circumstance where somebody that was very close to us got in an accident, got extremely hurt, and it took a toll on all of us, right? Everybody that was on that call, it was a rough day. We all got back to the station. We were all in tears. We did not have a good time. I'm not used to being in a small town. I'm used to being in the city where I run all the gangbangers that get shot. I don't know them from Adam. It didn't matter. You load them up, you take them to the hospital, and you move on with your day. Unfortunately, this one hit a little bit closer to home. It bothered me. I didn't like it. It was not fun for me. And luckily, I had a boss that was like, cool, y'all aren't having a good time. I've called a neighboring county to come down here and cover the station for y'all. Everybody goes home and send everybody home, right? And he didn't send everybody home to be by themselves. Pretty much everybody on that call had somebody to go home to. And so he sent everybody home just to kind of debrief, realize that, you know, we just went through some not so fun stuff and that we needed some time to process all of that. And that's the luxury of being in a system like this. You're not going to get that everywhere. Some places you go, they're like, dang, that sucks. You're still on the clock. You still got 16 more hours, right? And you're expected to run more calls and act like nothing ever happened. So with this class, I was able to learn some skills about being able to talk to folks, being able to walk in with a group of folks, sit down, and I'm not playing therapist. I'm not some kind of psychologist. I don't have a degree in anything, but I can relate to the things that they go through. So I can go in, I can sit down and kind of talk them through these processes, make them understand that it's all right. It's going to suck. You just got to embrace it, right? You got to embrace the suck, but you got to work through these processes so that you can move on, run another call, and, you know, be okay. You don't want to go home and put a bullet in your head, right? Because you'll find out in these slides that suicide is a very, very rampant thing when you get in EMS and fire, and you don't want to be that person. I've been to those funerals. I listen to those bagpipes, and it's not a good time. It's not fun to go to a friend's funeral because they decided that their time was no longer needed, and it's because of this job. So, again, every class has objectives. So, our objectives today, we're going to describe some leading causes of mental health emergencies in EMS, describe some signs and symptoms of burnout, discuss ways to prevent burnout, and discuss ways your coworkers and yourself can help in time of mental health crisis within your service. Whew. Jesus, I'm trying to breathe. It's kind of rough. I love this video. Do you? Oh, okay. I don't. You want to do that? I don't know what that means. Like I said, I was in the wrong generation of people. It's all right. We'll finish the PowerPoint and then we'll watch the video afterward. Maybe.
Sending an email. I don't know what's going on.
It's all right.
Okay.
All right. So we found out over the last couple of days what scene safety was. So what is scene safety? Not making another patient. Right. If somebody's running around with a pistol in their hand, do we want to run in there? No. That's what the sheriff's department gets paid all that money to do, right? So scene safety actually goes a little bit further in depth than that, right? If mentally you're not in a good place, do you feel like that scene's going to be safe for you to enter? No. You feel like if, like, mentally, right, you just ran this pediatric arrest and, you know, you're really just not sitting well on it. You're having a hard time. you feel like you're going to go into that scene and make viable decisions that's going to get you and your partner back out of there in a safe manner. And so scene safety goes further than just the crazy man running around naked with a knife, right? Scene safety comes back to our mental health too. You have to go into these scenes understanding that if you're not clear-headed, you're not going to make the right decisions, and you could not only get yourself hurt, but your partner hurt, right? And I'm here to tell you firsthand that when you go home at the end of the night, the things that's not going to keep you up at night is you getting yourself hurt. The thing that's going to keep you up at night is if me and one of my partners walk inside of a house and they end up hurt because of a decision that I made that was piss poor and got them hurt, right? And that's the stuff that's going to bother you. You get hurt, it sucks, and it's going to run you down for a little bit. But if you go home okay and your partner doesn't, that's in a whole nother world of hurt that you're not going to be able to understand until you experience it. Right? So here's some statistics that they ran. They did a couple of studies on suicide and EMS. So deaths contributed to suicide in EMTs is 5.2% versus the general public is 2.2%. And when you think about that number, you got to understand that we only make up probably about 5% of the population. And so when that number doesn't really look super high, when you consider we only make up 5% of the population, but somehow we're double the suicide rate of the general population, that's a big problem, right? And then you look at firefighters and EMTs, suicidal ideations, 46.8%. There's 6, 7 of us in here. So that means half of us have considered suicide in some sense, right? 19.2% have made a plan of suicide. And 15.5% have attempted suicide. That's a very significant number. And that's not okay. So my dad grew up in this. And I grew up in this because of my dad and my uncle, my mom. I know I told y'all yesterday, my whole family does this. My little brother's a cop. I got 2 cousins that are cops. My dad was a firefighter, went to the police department. Now he rides an ambulance. His twin brother rides an ambulance and has been for the last 30 years. And when they grew up in this, my dad started out as a volunteer firefighter in like 87, 88. I was born in 90. So my entire childhood was wrapped up in this. And one thing my dad and my uncle always said was, you signed up for this, like, suck it up. If you don't like it, go find something else to do, right? And that's not a good mindset to have, because at the end of the day, right, like we signed up to help people. And unfortunately, that comes with seeing the things that you're going to see and do the things that you're going to do. But that doesn't mean that you just get to suck it up and move on, because you're not going to. I've been doing this long enough to tell you that there's going to be calls that you run. There's calls that she's run that's bothered her. And I'm just like, yeah, it's just another call. And then on the flip side, right, me and her's been working together for about 4 years now. And there's calls that we've ran that I've walked out to the ambulance with tears in my eyes, and she didn't understand why, right? There's calls that's going to affect me that's not going to affect you, and there's calls that's going to affect you that don't affect me. But when you go home at the end of the night, you need to figure out how you come back the next day, how you keep doing what you're doing, right? Mental health is a stigma in fire EMS and the sheriff's department that, you just suck it up and you move on. And if I have to be the leading charge in this area to change that stigma, then I will be, because I'm not from here and I don't care. So I'm not part of the good old boy system that's stuck in the 90s. And I want y'all to go home, and I want y'all to be able to sleep at night. So everybody starts up here, right? Everybody loves this job. We got into it. We want to help people. We want to do all this cool stuff, And then there's this like declining effect where somewhere we get way down here, right? I'm tired of this, Grandpa. Right? And there's some things that lead up to that, right? Poor leadership, stressful situations, you're going to deal with them. Irregular hours, right? We work 96 hours straight. That's not normal. We wake up 2 or 3 o'clock in the morning. Poor Marcus over here has been awake almost every night this week. So, you sleep 2 or 3 hours, you get a 911 call, you go, might sleep 9 hours. You never really know. And abusive patients. And that doesn't just mean like the ones that come in there and like want to botch you. That just means like mentally, some of these people are mean. You're like, why are you being a dick to me? I'm here to help you, but it happens, right? Like we walk into these people's houses and you immediately get met with hostility. And you're just like, for what? Right. And it kind of drives you into a negative way, right? If I walk in somebody's house and I'm immediately met with hostility, I have to bring myself back because I tend to want to be like, well, frick you then. Like, let's, and you'll understand, right? But that's, you see this decline in people where they get in this and they're like, man, this is freaking awesome. We're doing all this cool stuff. And then a combination of these things gets you to a point where you just really don't want to show up to work every day. And we can't afford that. I know the sheriff's department, I know we are firefighters back in the 90s, you were begging to get on the sheriff's department or a fire department. And now they're begging for you to get on there. So, we don't have people just knocking down the door to get on these services anymore. So we got to keep the people we can. So, like I said, I grew up in a system where for 3.5, 4 years, it was a very mentally draining system. Me and her ran call after call after call. And I say this to enlighten people because it's good experience, but it's not anything to brag about. I have 2 certificates in our house, and both of them state that I ran the most cardiac arrests in the city of Atlanta for 2 years. That's freaking cool, right? It's rough on you, You don't really picture that, right? I've got certificates that show that I ran about 75 to 80 cardiac arrests in 2 years. When I got my paramedic license, the first 2 months of my paramedic license, I ran 15 cardiac arrests in the city of Atlanta. That means I had my hands on 15 dead people. Those 2 certificates don't show you all the people that we ran that were shot. Show you all the people that we ran that were in these really traumatic car wrecks. So that's just compounding, right? And in the 4 years that me and her spent in that city, do you know how many times somebody walked up to me and was like, bro, are you good? Not once. Not a single supervisor, not a single person in charge. They'd hand me the certificate and laugh about it and joke about it, but not a single person asked if we were okay. And she was right beside me for 90% of those calls. And not a single person asked her if she was okay. Luckily, we had each other, right? And so that's a big thing is you have to find somebody in this that you can trust. Because I knew that we ran a call on an older Hispanic male one day. And it just so happened to be about a month after my grandfather passed away. We walked in there and this older male, he was like, no, I'm not going to the hospital. I want to die right here. We knew he was dying. I couldn't change his mind, right? He wanted to die in his bed. There was nothing I could do to change his mind. He was with it. He could refuse. I walked back out of that ambulance in tears because that man reminded me of my grandfather. But I had a partner that was sitting beside me on that ambulance that didn't judge me for it. She didn't belittle me for it. She didn't make me feel bad for it. She asked me if I was good. We took 5 minutes. We got back in the truck and we went back down the road. And that's what you have to find in this. You have to find somebody that's willing to work you through these processes. You got to find somebody that's willing to help you. You got to find a good partnership, a good relationship, right? Like I said, recently we had an incident with one of our close friends. He almost passed away on us. We had 5 people from this service in the back of an ambulance trying to work on this individual to make sure that he didn't die on us. And I could tell you out of all 5 of those people, 3 of those people in here, one of them's in the hallway somewhere and one of them's sitting at home right now, and 2 sheriff's officers. One of the sheriff's officers is in this class and another one's probably sitting at the house right now because he's working today. All 7 of us were in tears by the end of that call. Not one of us made each other feel bad about it. Not one of us belittled anybody for it. And that's what you have to do. You can't make somebody feel bad because they have a rough time on a call. Just You might not have a rough time on that call. She didn't have a rough time on that older Hispanic male, right? That wasn't her call to have a bad time on, right? She had a call one night where a 4-year-old got shot in the head on Thanksgiving, and she had to work that cardiac arrest all the way to the hospital. I wasn't working with her that night. I saw her at the hospital. I walked up and gave her a hug. That's the only thing I could do. I can't say anything to fix that, right? I don't know what she's going through. That's a hard time. Make people understand that it's all right. Make people understand that you're there for them, and don't make them feel bad, if they're having a hard time with a call. Have them reach out to people. If you don't feel comfortable talking them through these processes, that's fine. There's people out there that can. So find those resources for these people and make them feel better. So, a couple of signs of burnout, right? If you see somebody that has a little bit of change in productivity, right? You got this really great paramedic, really great EMT, really great mine rescue guy, girl that shows up to work every day. They're really excited to be there. Well, maybe they're just not excited no more. Maybe they're not showing up doing the things that they used to. You see the changes in the attitude, the changes in their routine. Maybe they're showing up late. Maybe they just look junky. They're normally, pretty clean, well-kept people. They're just letting themselves go. Be mindful of that, right? Because these people are on their way out the door, and you don't want them to leave, right? They're good employees. They're good people. They're just having a hard time. So be mindful of those things. I really hate that this picture blurred out like this, but it says, think the flowers, feel the flowers, be the flowers, right? So these are some ways that you can prevent burnout on your end, right? I know that at our service, we get vacation time. Generally speaking, a lot of us don't take a lot of vacation time because we get 10 days off between shifts, which is super nice. You can go on vacation whenever you want to. But if you're having a hard time, take some vacation time. Frick them folks. I know for these mines, them folks that's sitting up there high up in them offices don't care anything about y'all. Y'all are a number on a piece of paper, and the folks don't care anything about y'all. So if you're having a rough time, take some time off, because there's a saying, they will fill your spot before they post your obituary. So take some time off. Frick them folks. Find somebody to confide in. Like I said, I was able to make it pretty well through the processes that we had in Atlanta because I had a great partner that I could just sit there and me and her would just talk. We'd have a rough call. We'd go get a Coca-Cola and we'd just sit there and chat, right? We could talk our way through these processes, and that makes things a lot easier. Find a new hobby. I know my wife likes crocheting and then reading the freaking weird little nasty books y'all like to read. So find a new hobby, right? Find something to do. Don't just sit around the house and mope and be pissed off at the world. Find something, go do it. We enjoy going. We spent a week driving up the Oregon coast about 3 weeks ago, right before the class started. Driving up the Oregon coast and sleeping in our car. Get away, find something to do, and then find another source of income. This is big in fire and EMS because fire, EMS, sheriff's department, we all have 2 or 3 jobs. Out here it's a little bit different, just because we actually get paid pretty decent. But a lot of places you don't get that luxury, and so you get 2 or 3 jobs. I had like 4 jobs at different fire departments at one point, and I was just hopping from one to the next. And was that beneficial for me in the long run? Probably not. Because my little black cloud that follows me around followed me to every one of those places. And so I was running the same calls at every one of these places. And, sometimes you just need to step away, have your main job, but then, go freaking sweep sidewalks on the side, whatever it takes to get away from this, because mentally your body it's going to get hammered and hammered and hammered, and eventually you're going to need a break. So find something else to do. I know at this point I built this class for something else, but my name and phone number's up here. if y'all run into an incidents, and you know, it might not be throughout the duration of this class, it might be once you get back to doing what you're doing, whether you're mine rescue, whether you're with the sheriff's department, fire department, I don't care. And whether it's 2 o'clock in the morning or 2 o'clock in the afternoon, if you call me once, I'm probably not going to answer. If you call me multiple times and send me a text message, that generally gets my attention. I typically, you know, I'll text back or call back then. But, you know, call, reach out. I have the critical incident stress management class. I am more than happy to come in and sit in and talk with folks. If I'm on the call, I'm not going to come talk to you. That's one of the big things they teach you in that class is if you're a part of the call, you can't lead a debriefing. But if I'm not there, if you're at the mine site and something, you know, really crappy happens and everybody's having a pretty rough time, and, you know, listen, we had, when we started this critical incident stress management thing in Georgia, we were building a team to be able to deploy out to local fire departments, EMS, police departments, and be able to do these services for these people. And I mean, it's fantastic, but you know, we're only good as people allow us to be. And unfortunately, with these big companies and services and stuff, you have what they call the freaking EAP people. And I freaking hate those people because they'll get on the phone and they'll be like, I understand what you're going through. No, the freak you don't. I just saw somebody shot in the head. Like, you ain't got a goddamn clue what I'm looking at, right? We had a lady walk in and she was like, I was a flight attendant once. I know what you're going through. And I was like, what? How does that even correlate? Everybody just instantly stopped listening to what she had to say. So if you just want to go sit down and have a cup of coffee, I'm generally free for that. Sit down for lunch. I'm fine with that. But the biggest thing that I want to see is mental health in this become a normal thing. Because up until this point, it has not been a normal thing. And I know people, you know, Mr. Marcus back there grew up in a fire department household. Mr. Garrett back there grew up in a fire department household. And those people do not talk about those things. You know, you just freaking suck it up and deal with it. And that is a stigma that has to go away because we are in a world where you're seeing worse stuff. You're seeing it more often. And you just have to, you know, you have to be able to work through those processes. So I'm a big advocate of it. If you need me, call me. Hopefully I won't be sick and I can actually have conversations with people without running out of breath. But yeah, anybody got any questions? Cool. Your turn.
I can take a break. Let's do 15 minutes. And then when we come back, we'll go over the medical terminology. And I will stand up for y'all.
Sound good? Yeah, hopefully. Yeah.
Sorry. Is it on now? Sorry. Austin, go ahead and take a 15-minute break. When we get back, we're going to do the medical terminology PowerPoint. And
This conference will now be recorded.
All right.
Never mind.
Those
Okay.
Those sheets, we're not putting a grade on them. They're for your reference. Study them, understand them, go over them, understand them some more. Here in a couple weeks, we're going to start doing some scenarios. We're going to start running some calls. We're going to start doing some stuff like that. And there's some pretty easy, pretty standard stuff on the top of that sheet. If I look at you and say that the patient's hypotensive, expect you to know what that is. So, like I said, there's some terms in here that you're not going to be able to get away with not knowing. Stuff like tachy, Brady, hyper, cardio, stuff like that. That's all stuff that you're going to have to know to pass national registry. There's some really off the wall stuff that you'll hear as you kind of go along that you might not hear again for years. But you need to really, really pound out this medical terminology stuff. Make you some flashcards, make you some study material, however you like to study, and then be able to walk in and have a conversation with one of us about what's going on with the patient, because we're going to start this process out where it's like kind of lenient. By the time this class is over, I'd expect people to be able to tell me what's going on with a patient in full medical terminology, because that's the only way you're going to pass national registry is be able to talk like that. And it's really not hard. Once you grasp it, once you understand like the basic keywords, you can kind of hone in on the majority of it. So
One thing that's going to be really helpful with those worksheets, we're going to do a Kahoots if we can get it up, if we have enough time tonight. A lot of the answers for that are going to be in the Kahoots. Another thing, I think it's page 1300 in your guys' books. It starts out like all your medical terminology. So there's a bunch of reference points in there. Also, Google is free. So
I will harp on this and harp on it and harp on it and try not to sound like a dick about it, but I kind of have to, because if you don't understand this medical terminology, you will not pass these tests. And so by the end of this class, if I look at you and say, somebody's heart rate is 22, and I go, oh, what's wrong with their heart rate? And you say, well, it's low. That's not going to fly. Right. So we're gonna work on the medical terminology as we go, but it's something that we're gonna have to really, really push in on.
yeah. All right. So this PowerPoint is going to be pretty short, sweet, to the point. Like he said, most of the stuff you learn this way is going to be through doing it through scenarios, other stuff in the book. So it's just kind of give you a general idea. So our objectives are going to be identify components of words. That's going to be important whenever you're looking at like where the words derive from. It kind of tells you what part of the body you're thinking about or what have you. Directional terms and positional terms. So we went over this a little bit yesterday in one of the PowerPoints with like the supine, prone, if you guys can remember that kind of stuff. So we're just going to touch on it again. So compounds are made of two or more words, a little English lesson here. Words made from parts. So the roots, therm is meaning heat. So thermometer, the roots with the combining form therm, meaning heat, and then meter, it measures the temperature, right? So prefixes is anything that goes before the word, like your dyspnea, DYS is the prefix, and tachy, like Chaz was saying, tachy means what? Fast, yeah. And then we have our suffixes, which is going to be at the end of the word. So itis, meaning what? Okay. And the iac part of the hemophiliac, was that? A person that has it. All right, so here's this word, cardiologist. It's broken down. Cardio, the heart. Ology is the study of. I want to say ology, but there's no O. Ology. And then ist is someone who specializes in it, so cardiologist. So we also use a lot of abbreviations whenever we're writing like our charting, just general speaking, we use a lot of abbreviations. So one example is like CPAP. It stands for something. It stands for continuous positive airway pressure. but we say CPAP because it's too much to be like, hey, hand me the continuous positive airway pressure machine. You know, it's too much. So we do use some of these whenever we start putting our hands on stuff during like scenarios and stuff. You'll become more familiar putting, you know, like a BBM in your hand, and you're like, okay, this is a BBM. Most people don't refer to it as a bag valve mask, just those kinds of things. All right. It says English is challenging. It can be learned through tough, thorough thought, though. So we're going to dissect this word, cholecystitis. Chole means bile. Cyst is a closed sac, and itis means inflammation. So cholecystitis is the inflammation of what? Anybody? A closed sac that holds bile. What's that? Not quite. Gallbladder. Mm-hmm. All right. Whenever you're using medical terms, Chaz and I are going to expect you to use them by the end of this class. Whenever we start going through scenarios, I want you to use medical terms. Whenever you're talking to the patient or the patient's family or anybody related to that patient, don't talk to them like they're dumb, but don't use like really, really big words, right? So if I walk in, I'm like, oh yeah, his carotid is bifurcated at the blah, blah, blah. They're going to be like, what? So try and use general speaking terms whenever you're talking about that, okay? Yeah, and it can cause confusion even among trained healthcare professionals. So anatomy and physiology, what is it? Anatomy is the study of the body structure. So it's where it is in the body. Physiology is going to be how it works. There's going to be a difference. So like anatomy is like that picture of the little anatomy guy. Where's this? Where does this go? All this stuff. Physiology, cellular level, how is this going to work? Whenever we're referring to anatomic terms, it's going to be in reference to the anatomic position. So the anatomic position is standing with your hands out like his and forward. So whenever you're talking about like anterior, posterior, this is what you're referring to as this picture. So like anterior, posterior. So that back of your hands would be what? Posterior. So these planes, you guys probably saw this same picture in your book. There's a couple little ways that you can remember them. So the best way I can remember the frontal plane or the coronal plane is if you have a corona, like a beer, you want it being sat in front of you. So coronal plane. Transverse, that one just cuts in half. I don't have anything special for that. But your sagittal plane, I think of like Sagittarius. I'm not like one of those horoscope people, but like if you look at the picture of Sagittarius, they're holding a bow and arrow and it's cutting them in half this way. So that's how I remember that. But you guys can find your own little ways to remember. Talking about midline, if it's medial, that means that it's going to be closer to the center. If it's lateral, it's going to be further from the midline. You can also use these terms whenever it comes to like rotating or movement. So like you have a lateral rotation that's away from the midline, right? And then you have your medial rotation, which brings it back towards that midline. So if somebody says bilateral, what does that mean? Okay, there's two. Okay, so if I was describing like, if I said bilateral bruises on the legs, what does that mean? Both legs have a bruise. Okay. What about unilateral? Yeah, one leg. So one-sided. And then you have mid-axillary. So what this is talking about is your axillary line is going to come up here through your armpit. So mid-axillary is going to go right down the middle of your armpit. then you have your anterior axillary, which is more forward, right? Because we're thinking about our anatomical guy. And then your posterior axillary, which is going to be closer to the back. So this is what view of this person? Front. It's anatomical, but you're looking at, I think you said it, anterior. So this is the anterior view. What is this? Posterior, yeah. So then you, whenever you're talking about where it sits, superior is going to be above, like your supervisor, and then inferior is going to be below. And then more directional terms, they just keep coming. It gets better. So whenever you're talking about closer to the body, it's going to be proximal. And whenever it's further away from the body, it's going to be distal because it's a distance, right? Then you have your dorsal and your dorsal and your palmar, because this is your palm. The only difference between the foot is a plantar, right? So instead of palmar, it's going to be plantar. I remember that because you plant your foot on the ground. That's how I remember. So here they also talk about, or they show like a midclavicular line. I have another picture in here. It's a little bit better in showing where that midclavicular line is. Whenever we're talking about midclavicular, I want you to remember that our clavicle doesn't just stop here. Your clavicle comes from the center all the way over here to your shoulder. So a lot of people just think it's like this long, but it's actually a little bit longer than that. So whenever you're thinking midclavicular, it's going to be a little bit more over than you would initially think. It is technically down the nipple line here, but you know, nipples like to sit wherever they want to sit. So it's kind of, you can say like nipple line, but that nipple might not be there. But yeah, so midclavicular, if his collarbone was only about here, it would be like here in the middle, but it's not. It goes all the way to his shoulder. So midclavicular is going to be right here. One easy way to find a midclavicular line on somebody, which this comes into play a little bit further more in training, but if you take your thumb and put it on this notch right here, and you take your pinky and put it on the edge of their shoulder, you take your middle finger and put it down, that's midclavicular right there. Does that make sense? So we have two midclavicular lines. And then we have our abdominal quadrants. Why would this be important to know which quadrant is where? Yeah, exactly. So if somebody's hurt or hurting somewhere, you can kind of envision a little bit of what is involved, right? So if it's right upper quadrant, what's going to be involved? What sits right here? Liver. Yeah, liver, gallbladder. There's lungs up in there. Okay, what about right lower quadrant? Yeah, appendix. Yeah, it's pretty much intestines, appendix. Appendix is the big one there, but yeah, it's your stomach. What about left lower quadrant? Just intestines, really. So if someone's having left lower quadrant pain, most of the time it's going to be something like diverticulitis, something to do, gas, those kinds of things, constipation. And always keep in mind that this is the patient's left and right. It's not going to be your left and right. So like if I'm looking at you, this is going to be your left and then my right. So as you're describing this, make sure you're using the patient's left and right. And it can be very confusing. Sometimes I have to take a step back and be like, okay, where were we sitting? Where was it at?
Remember the liver. You take a left hook to the right side. That's where you
Oh yeah,
it's
big. Yeah, that liver can be a pain in the butt. All right, so we just went over some of this. What about the left upper quadrant? Stomach, spleen. What's special about the spleen? I mean, all the organs can kind of do this, but what does the spleen do? Very bloody. Yes, it makes your red blood cells. So these are things to keep in mind whenever you're looking at like a trauma patient or somebody that's having a lot of pain in these areas, what goes into that area. Another thing I want to point out here is your diaphragm, right? So you find your little notch right here. It kind of sits kind of lower than I would think most of the time. But if you look at the size of your lungs, if you go like this with your hand and put it up in your armpit, that's about the size of your lungs. So that's something to keep in mind too when it comes to trauma. So they might have a wound further down, but they could have lung involvement. So that's always something to keep in mind. We talked about this yesterday. What is this one on the top here? Okay, and what about this one? I just like her face. She looks like she's not having a good time. What about this? Yeah, left recovery or left lateral recumbent. What about this one here? Okay, yeah. What about that? What's that? Trendelenburg, yes. All right, and that's it. Any questions about the medical terminology stuff? No.
I'm going to say it again in case I haven't said it already. This is really important. You have to learn it. You have to understand it. You have to learn it. It can be kind of daunting when you're talking about distal and proximal and midline and all this other stuff, but it's extremely important information that you really, really need to pick up. Because if I look at you and go, well, you know, this person's got an open fracture that's, you know, distal to their elbow on the right side unilaterally, you have any idea what I just said? If you see that on a test, are you going to be able to answer where that break is in their arm? And so if you can't answer that, right, I'm sure some can, but if you can't answer that, that's how some of these questions are going to be presented to you. And so you need to understand what that means, right? So just keep that in mind. And understand like that the National Registry is there to trip you up. So if they can find a loophole by throwing a couple of medical terminology questions at you and you don't understand them, then they're going to get you every time.
All right. Are you guys familiar with Cahoots? Okay. Anybody not familiar? Okay. So do you think for our first one we should do teams?
Yeah.
Okay.
Sure.
So we can do teams of how many do we have in there?
Oh.
Have you got Team Austin?
Hashtag Team Austin.
Can we even hear them?
Yeah. Miranda.
Yes.
Yeah.
Okay.
There they go.
So let's do teams, and then if you guys want to split into teams, I'm bad at math, however many.
Or you just want to do it in tables?
Yeah, we could do it in tables.
Yeah. Everybody get friendly. Pick a person.
Find somebody that has, you can either create an account on Cahoots, or if you have, there's an app, I think, if you download it.
It's good. It's perfect. Everybody's good.
I'm just kidding.
I don't think so. You might be able to. There's a little thing.
Yeah, we already paid for this.
Yeah, QR code. That's the word.
So everybody, pick somebody at your little line of tables. So we're just going to run through this kind of easy this round.
There's 30 questions.
No, you can go.
We need a prize if we win.
Yeah, we'll start working on prizes.
Okay.
This first one's a trial run.
All right. Just one person. One device per team.
You're a device guy.
One device per team.
But for future reference, when we do this in the future, everybody's going to have their own account. So if you do not have a Kahoots account, work on that this week, because we're going to do this more often. Just to kind
Team
of,
Austin, we see you.
there's not going to be any kind of affecting grade, but there may or may not be coffee as a prize or.
Yeah.
Yeah.
Don't pay for it. Yeah.
Better the online one or the
You know, I don't know.
doesn't matter.
Honestly, I don't think so. Maybe like accessibility
Are y'all
wise,
on the
that might
team?
be easier.
Are you doing one?
Oh no.
Anybody that beats this team, they will buy you coffee next time you're here.
What's the name of the team again?
Oh, really?
Hashtag Team Austin. I like it.
Hashtag
All right.
Austin. Do we have everybody?
No.
Are we missing? Okay.
2 months.
All right. So we got the Mine folks. We got the BLM folks. We got the Austin folks. What about y'all in the back? Who y'all got working this?
Avocado. That's awesome.
All right. What about y'all?
Yeah, that's hilarious. I like it. That's what I've been like calling you. Yeah. Okay.
Embrace it. Love it.
Fair enough. Michael Harris. Michael Harris. Michael Harris. Okay. I think we're ready. Is anybody not ready?
Like,
Hold on.
who are you What's your name?
He's getting there.
Oh.
So not really. You
Hold on,
should do
Beck.
Dr. Mustache. That's who you should
Hold
do.
on. Hold on before you start.
Dr.
Okay.
Stash.
Listen, they're kind of cheating because they got a neurologist on their team.
Yeah, not fair.
Neurologist, paramedic, and some Marcus.
You want a handicap?
Can you? I don't know if you can do it. Maybe not. Maybe.
I got my faith in Team Austin.
Yeah. Go for it. All right, we're ready. Everybody get into answering question position. Maybe. Do I need to click? Here we go. Oh no.
Oh, no, you freaking.
Oh no. Okay. All right. Define the prefix hyper. All right. Everybody got that right? Good job. Good job. Golf clap. Golf clap. I think you have 20 seconds. So, all right. Everybody ready for the next one? Okay.
You cheating.
True or false? Nephritis means inflammation of the liver. Uh-oh. I think we're missing one person. Oh.
Uh-oh.
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 Oh, no. All right, so nephritis is not the liver. It's the inflammation of the kidneys.
Just so y'all know, there may or may not be pictures in here to throw y'all off.
You're
So,
not supposed to tell them that.
well, some of these do have pictures
All right,
on
here we
it.
go. Define the prefix poly.
I can't. I was faster. It was loading on it.
All right, good job, everybody. Good job.
Uh-oh.
All right, so
So
example, polyuria, excessive urination. Many
polyfarm, excessive medication. So we run into like polyfarm overdoses where people just take a bunch of medications. So
All right, here we go. The prefix dis means what? I wish these pictures were bigger. They're so tiny. When I uploaded them, they were big. All right. I think we had one person not answer that.
I'm struggling. I'm short and all I see is head.
Oh no.
I really can't see you.
so when we're
Like head here, head here, head here.
when we're talking about this prefix dis, how do you think that this plays out in medical terminology? Like, what's an example of this used in a medical term? Dyspnea. What does that mean? Yep.
Good.
So
What would it be called if it was no breathing at all? That's the color that they turn.
yeah.
It is
Apnea.
apnea.
Yep.
No breath. Okay.
They not breathing.
They can't breathe.
Uh-oh.
Oh no. Oh, they're 1 point. Oh Lord. Okay. Angina means what in medical terms? Oh, my head's in the way. Against, opposed to, preventing, relieving, chest pain caused by reduced blood flow to the heart, fatty tissue, or abnormal condition.
Good job. Uh-oh.
Oh no. 5 points this time. They're quicker. All right, true or false? Arthroscopy is a surgical procedure used to examine joints. I think that's how you say it.
This picture
Arthroscopy.
come out real small.
They did. That's unfortunate. It's a picture of hands with joints that are inflamed. True. Good job. Scoreboard. Austin's on fire. They're doing good. Austin has a streak with 6 correct answers in a row. All right. Define the term hematology. Hematology?
Hematology?
Hematology? Hematology. Ooh, they were quick that time. Study of blood and blood disorders. Now Wall has a streak with 7 correct answers in a row. Uh-oh.
Define the term dermatitis.
All right.
Quick with it.
Yeah, man. I need to start making these harder.
Yeah.
Michael Harry has 8 correct answers in a row.
Define the meaning of the prefix sub. All the freaking answers is like 0007.
No way.
Which suffix means blood condition?
Well, we're about to find out. Okay.
Ooh, caught a couple.
That was
people.
close.
So emia was the correct answer.
No way. One wrong.
3 players have reached answer streak 10. All right, true or false? Cardiopathy is another term for a heart attack. True or false? Ooh. They're so close still. All right. Cardiopathy is the disease of the heart. Blank is a term for a disease caused by insufficient blood supply to tissues. Hematoma, neuritis, polyuria, or ischemia. I really wish my pictures would have been better. All right. Ooh. Yeah. So a couple people chose hematoma. So a couple people chose hematoma. It was not hematoma, it's ischemia. So ischemia is that of insufficient blood supply to the tissues. Ugh, can't talk.
So when this applies to us, when we start talking about ischemia, like with people who have heart attacks and they get that blockage, they get that ischemia in their heart, is what we're talking about, because they're not getting that sufficient blood supply to their heart. And that's where you see people where we say, oh, we're running a 12 lead on somebody and we're looking for this stuff. That's where you see that stuff pop up at.
You see the ischemia.
Oh man,
Osteoporosis is a condition in which the liver is removed due to insufficient blood flow. The bones become weak and brittle. The stomach and intestines become inflamed. All right. Good job. I like it. Oh, click faster. I can speak. Blank is a medical term for an abnormal increase in white blood cells.
Big sick.
Big stick.
big sick.
You know,
Nice job.
ironically enough, when somebody is big sick, don't they have an increase in white blood cells?
Ooh, girls have a streak. Which abbreviation stands for prescription? Easy. True or false? Arthralgia means pain in joints. Ooh, it is true. Oh no. If your patient presents with hives and itching, what system is affected?
It's working too hard.
Good job, good job. No change in the scoreboard. A normal SpO2 for your adult patient should be what? It's part of their little handout. It talks about like SpO2 and abbreviations and stuff. All right, so SpO2 is your oxygen concentration in your blood. So we want it to be 95 to 100.
That's right.
Ooh.
Coming for you, baby.
What does nephrectomy mean? I really wish the picture would have showed. 4 little fingers. All right, it is the surgical removal of a kidney. I put a picture there of a surgical removal of a finger so you guys would get confused. All right. Oh.
Once again,
True or false? 39 degrees Celsius is a normal temperature for an adult.
Uh-oh.
what's that formula?
From Canada, eh?
Well, that's
False. 37 is normal for an adult in Celsius.
gonna add like
Oh, Mike Harris.
now, right? You doing good? The comeback. We're actually they're gonna get the rest of the month. Yeah.
What term describes an allergic reaction that may cause difficulty breathing, swelling, and shock? Good job. Good job.
So bonus points.
What term describes the inflammation of stomach and intestines?
There you go.
What was the bonus question?
Bonus point. Does anybody know the difference between what makes it an allergic reaction and anaphylaxis?
White blood cells.
Huh?
The body mechanism.
There you go. So if you have 2 or more systems involved, it turns it into anaphylaxis versus allergic reaction.
Or airway. You can have 2 different systems involved. So like GI and skin, that's 2, that's anaphylaxis. But if it's just airway and it's airway, that's anaphylaxis as well.
How many points is that?
Extra points.
We're not last though. Not first year last.
Cerebrovascular accident is also known as what? That's not fair. It's cheating. Good job. Stroke. So CVA, you might hear this interchangeably in the field. They might say CVA, they might say stroke, they might say brain attack. They all mean the same thing.
TIA.
TIA is almost the same thing, but it's not. Hyperglycemia and hypoglycemia occur in what condition?
It's definitely green.
It is. What is green? Yeah. What's the number 1 cause of epistaxis? Digital trauma.
I was gonna pick it.
Those stickers?
Yeah.
Old stickers?
Yep. Oh, who's A? They're making it up. I like it. All right. The suffix plasia means what? Ooh. All right. So it is formation or growth.
Well, I knew it, but then she confirmed it.
True or false? Hematoma refers to a collection of blood outside of the blood vessels.
Tomato.
Yeah. Good job. Yeah. Last question. What word would describe pain in the nerves?
Yeah, that made my heart really happy. I'm so glad. You left our phone glitched out. Actually, I'm in the lead.
All right. Here's the podium. Good job.
We get the extra points for
Right.
So everybody knows, no more EMS.
So going forward, we're going to do this more often as time permits. We're not going to keep y'all till 9 o'clock trying to play Cahoots. Download it on your phone. Sometimes we'll do team events where we'll break you up into a couple of different teams, but for the most part, we're going to try to do it individually, just so we can, it kind of pushes you to, do a little bit more research and a little bit more studying to kind of boost your numbers up. There may or may not be prizes involved in it for winners. So just keep that in mind. So get it downloaded on your phone. Come to class with your phone on charge, charged up, ready to go.
Chad, they can go back and replay it.
Yeah.
Oh yeah.
All the quizzes that we created, straight title of EMS. For the EMS class.
Yeah. I think you should. I think I have to make it public, but yeah. Yeah.
All right. Does anybody down in Austin have any questions, complaints, gripes?
No, I think we're good.
Perfect.
Awesome.
Well, if y'all are good, there's going to be a test on Tuesday. There's going to be a test on Tuesday over Chapter 5.
Actually,
But
is there any way that we can face the camera towards the instructors next time?
yeah, we can try. It's kind of hard because we need some sort of extender, so we'll try to work on that. But there is going to be a test on Tuesday over Chapter 5. Saturday CPR class, I did misspeak. Everybody has to attend because it goes towards your hours for the end of class. So Saturday CPR class taught by the late great Mr. CJ. After CPR class is done, I will be on shift, and so we're going to bring the ambulance over. We're going to go through the ambulance, probably go over some movements, get the stretcher out, move the stretcher around, just kind of go over a bunch of equipment on the ambulance. So be here 9 o'clock Saturday morning, and we'll party out again. Yeah. So once we get through the CPR class, everybody, I think it's like a couple of days or a week or whatever, you'll get a CPR card and all that stuff. So, yeah. So,
Cool.
if nobody has anything, I think we're good. You're good. See y'all on Saturday.
Hey, Chaz.
Yes.
Or Rebecca, one of you two.
Yeah.
Are we doing it down here in Austin, or do we have to be in Battle Mountain?
Yeah, I talked to Kim. She said she was going to be down there on Saturday. So I'll touch bases with her again and make sure it's down there, and then I'll send an email out to y'all.
Okay, cool. Thanks.
Yeah, no problem.
All right. Talk to you guys later. Bye.
Thank you. Bye.
Yeah.